As I said earlier, I'm a dialysis nurse and I work for DaVita. We are a dialysis service provider and we provide it in various settings. We provide dialysis in outpatient units, in hospital settings, and also now we're happy to provide and partner with skilled nursing facilities to provide in-house dialysis services. Dialysis is a life-saving and a very important treatment for people whose kidneys have stopped working. It's an artificial process that simulates the same functions that our kidneys provide for us. Our kidneys do a lot of different things, but the two main things that most people think of when you think of kidneys is they filter our blood and they take out the buildup of toxins that happens naturally in our bodies. And they also produce urine, which helps to control the amount of fluid that our body maintains. So that's what we provide for people whose kidneys have failed and who need that service.
Judy, do you have to dialyze 3 times a week? Is that required?
3 times a week is the common prescription for dialysis. It's been determined over time and with research that the best way to maintain the best quality of life is to have that treatment 3 times a week. And as I said, dialysis filters out toxins and fluid and helps us control fluid, but it also maintains really important chemicals and minerals and compounds in our bodies that we use in our daily cellular activity. And so if there are buildup of certain compounds or chemicals, it can cause really adverse effects for people. So in order to maintain the best long-term health and safety, dialysis is 3 times a week. And yes, that can seem like a big time commitment, but looking at the outcomes, that's the best thing for you to do.
Mm-hmm. And we have found with seeing an increase in dialysis patients, we decided we partnered with DaVita to open an in-house dialysis clinic at our community, Carmel Health and Living. And Jen, why don't you tell us a little bit about how that partnership works and the benefits of having that in-house with us?
Sure. Well, yes, as you said, we've partnered with DaVita at Carmel Health and Living, and really the goal was to alleviate a lot of the issues that we were seeing with residents having to go out for dialysis, and that was delays or missing transportation. And by missing transportation, they missed the appointment, or if they were too late to the appointment, they wouldn't be able to dialyze that day, which can be very detrimental for the residents. Just the communication piece by having the dialysis clinic in-house. It's the same team of people working together, which has been huge. At Carmel specifically, we have the same team working together down the same unit. So they're able to talk to each other very freely. They know each other. They know the residents very well. So that is a great way to kind of build that relationship with them. And again, back to the travel piece, by them just having to go down the hallway, a couple 100 feet or 50 feet, wherever they're staying, it alleviates that time of transportation, which could be 30 minutes to an hour, depending on where their clinic was, which can be exhausting. Dialysis is takes a lot out of someone. Mm-hmm. So by having that time to just relax and recover, because it's so close to where they're actually living, just gives them a lot of time back in their day as well.
Well, I know this topic is very near and dear to my heart because I have a loved one at Carmel that is using the dialysis, and it's just been a lifesaver for us. So I appreciate it so much. We talked a little bit about this, but how does Cardon work with DaVita Dialysis? We travel a long way for dialysis now and would like to find a community that offers dialysis services. Jen, I'm going to give that to you if you don't mind.
Like I said, we partner with them. We've actually partnered for Carmel, but are excited to announce that we're partnering with a few more communities. So that will be coming out soon. We've seen such great success at Carmel with all of the things that we discussed of, not having to worry about transportation, having the same teams be able to work together, and just the communication piece back and forth to give the residents a better experience. So we've partnered with DaVita just to try to make the best experience for our residents, because at the end of the day, we want to do what's best for them and get them feeling good. And if they're goal is to get back home, get them back home as quickly as we can.